Recovery People and C4 Innovations is excited to announce medication assisted treatment Proficient recovery housing, pioneers in the opiate crisis. This advanced learning collaborative will help recovery housing providers become proficient at supporting persons prescribed medication assisted treatment. A growing number of persons are undergoing medication assisted treatment as a pathway to recovery, only to discover that their recovery housing application may get rejected or the living environment is not fully supportive. Early research indicates that it's not enough for a recovery home to modify its eligibility criteria. Recovery housing providers must adapt their programs, their policies, and their procedures, as well as facilitate cultural change in order to become proficient at supporting medication assisted recovery. This learning collaborative is brought to you by C4 Innovations, which promotes best practices that improve the lives of marginalized and vulnerable people, as well as Recovery People that promotes peer and family led recovery from substance use and related mental health. While not all who are undergoing MAT are seeking recovery, taking medication as prescribed may be some people's best chance at achieving recovery, whereas medication assisted treatment emerged out of harm reduction and medical models. Recovery housing emerged out of social model recovery and has this symbiotic relationship with absence based recovery communities. As a result, these two worlds have largely been isolated from one another. Today, the concept of medication assisted recovery, or MAR, is a framework that is bridging this gap. So, when we talk about MAR, or medication assisted treatment, we can describe it as a three-legged stool. This is about getting individuals access to FDA approved medications or medication assisted treatment, getting them connected to cognitive behavioral therapy or other psychosocial supports, as well as connection to recovery support services, namely recovery housing. Because persons on MAT have not historically lived in recovery housing, we have to ask, what's the proficiency level of the recovery housing marketplace at supporting persons on MAT? Well, we can safely say there is a huge opportunity for improvement. To graphically represent the marketplace, we have drawn a horizontal line that represents the degree a provider is capable of supporting someone on MAT, and a vertical line that represents the degree a provider is willing to support someone on MAT. In the face of the opiate crisis, we need to focus efforts towards shifting marketplace capacity towards the upper right hand quadrant, meaning we need to increase the number of providers who are both truly willing and truly capable of supporting persons on MAT. To accomplish proficiency, recovery housing providers will need to overcome several gaps. The knowledge gap, for instance, which includes a lack of medication assisted recovery lived experience amongst recovery housing leadership, and the lack of practice based evidence that would point us towards best practices, much less research that validates any of those best practices. Then we have to ask, where is right for whom? One size doesn't fit all. And pioneers in this field are still trying to figure out what type of support, what level of support do persons on MAT need and want. And then there's the culture clash. At its core, recovery housing is about assimilating new residents into a culture of recovery. But what if that culture is not supportive of MAT? A change in culture just doesn't happen overnight. So we need to ask, what's the next step in getting that culture change? Then we have to talk about the safety risk. All opiate agonist medications have diversion and addictive potential, which causes a safety risk to the individual prescribed the medication, to the other residents within the recovery home, as well as the peer staff. We have to acknowledge the risk in order to figure out ways to mitigate it. And then finally, uncoordinated care. Primary care and behavioral health treatment has not had the best track record for coordinating care. So it's not surprising that most MAT prescribers and recovery housing providers don't have a working relationship. That needs to change if we want to support medication assisted recovery. This can all sound really overwhelming until you realize that social entrepreneurship is the mother of all recovery housing. Since its inception, recovery housing is a solution that has been designed and developed to meet the glaring needs of persons with substance use issues. Back at its origin, the 1800s, the earliest known recovery homes were developed by the Washingtonians as a part of the temperance movement. In the 1900s, soon after the birth of Alcoholics Anonymous, there were AA homes and AA farms. Over a few decades, these programs evolved into addiction treatment. We saw therapeutic communities and halfway house models evolve to meet the needs of persons with substance use disorder, meaning many of them were incarcerated or formerly incarcerated. While some recovery homes added services and added staffing throughout the 1900s, there were also less intensive models such as Oxford House and Sober Livings that evolved to provide more affordable and more permanent supportive housing options. In the 2000s, the National Alliance for Recovery Residences defined the spectrum of recovery housing options that existed in the marketplace in that snapshot and identified best practices. But that doesn't stop the need for evolution. While opiate use disorder is not new, the current opiate crisis is. There's a clear need to adapt recovery housing practices to meet the needs of the current marketplace. While being responsive to the marketplace will be key, we must also preserve fidelity. Historically, recovery housing has been pressured to evolve into things that it's not. To prevent this misstep, we must ensure that medication assisted proficient recovery housing stays securely grounded in social model recovery philosophy, which consists of 5 domains. Is it home like? Does it utilize peer based authority? Does it utilize peer governance? Is it recovery oriented? And is it community oriented? If you're a pioneer in the recovery housing industry who's committed to doing your part to address the opiate crisis and to proficiently support persons on MAT, then register for this learning collaborative. Now, it's an advanced group, so we're going to assume that you already understand one, how to open and operate a recovery home that meets national best practices, and two, that you understand the various types of medication assisted treatment and their role in treating opiate use disorder. We should also help set your expectations. You're going to get as much out of this learning collaborative as you put into it. When it comes to medication assisted recovery housing, we're largely charting new territory. Much of the learning will be done outside of the time that we have together. The learning collaborative is about introducing you to concepts and tools as a group, discussing those concepts and tools, all to get a better idea of what it is that you want to implement in your organization or for yourself. It's really up to each participant to develop and implement a strategy and an action plan that's right for you, for your priority population, and for your organization. So, kind of an overview of the course. It is 6 sessions over 6 weeks, and each session is going to include some pre-work. So you'll be able to log on to your account using your username and password to access different readings and videos that prep you for the weekly community of practice. The community of practice is facilitated and an interactive discussion amongst the participants within the learning collaborative, and it's done over a video conferencing platform. And then there'll be homework. You'll go back to log into your account where you'll complete some exercises in order to deepen your learning and really facilitate the implementation of your strategy for you and for your organization. People may want to know, so is there continuing education units? The answer is yes. At the end of each session, participants will have the opportunity to take a knowledge assessment. Certificates of completion will be awarded to those who score at least 80% or higher. And we're very excited to introduce you to our faculty who are exceptionally qualified to lead this learning collaborative. First is Jason Howell. Jason is a person in long term recovery with a master's in business administration and is a certified peer recovery specialist and a certified peer supervisor. Jason opened his first recovery home in 2008, but today he's the executive director of Recovery People and has contributed to numerous published journal articles on recovery housing, including a guide for helping recovery residences adapt to support people with medication assisted recovery or MAR. Jason serves on the Texas Behavioral Health Advisory Council, on SAMHSA's Center for Substance Abuse Treatment National Advisory Council, and on the board of the National Alliance for Recovery Residences. Next, we have Erin Helms, who is a woman in long term recovery, a licensed chemical dependency counselor, and is the executive director of the Woodrow Project, which provides recovery housing to women in Lakewood, Ohio. In response to the opiate crisis, Erin developed recovery housing that supports residents using medication assisted treatment along their pathway to recovery. Erin is also a board member of the National Alliance for Recovery Residences. Third is John Cox. John is a senior associate at C4 Innovations with 25 years of experience working in the homeless, substance abuse, and supported housing arena in both the United States and in the United Kingdom. John leads C4's recovery housing technical assistance as part of SAMHSA's Opiate Response Network and C4's housing and homeless technical assistance funded by HUD. Then we have Pace Lawson. Pace is a person in long term recovery, a licensed chemical dependency counselor, a licensed professional counselor intern, and a certified methadone advocate. Pace has experience opening and managing recovery housing, as well as providing counseling services to persons with opiate use disorder within a methadone clinic. Pace has a passion for working with veterans and rural populations. Currently, Pace leads Recovery People's training and technical assistance projects. So if this sounds good to you, then definitely we want you to register today. If you identify as a pioneer in the recovery housing industry that is committed to supporting persons in MAT along a pathway of recovery, and if you want to join like-minded individuals in identifying practice-based evidence, then this learning collaborative may be perfect for you. Now, seating is limited, so you may want to register today. Please follow the link that is associated with this particular video to learn more information. Thank you, and we look forward to seeing you in the community of practice.